Hello students. So today we will learn about the study of anti-ulcer activity using pylorus ligation method. So here are three tabs. First one will be the introduction, second the experiment and the observation. First we learn about what is the principle behind to study about the anti-ulcer activity. So as we know that the peptic ulcer is the one of the most prevalent gastrointestinal disorder amongst the all GIT disorder. So the aim of this present study is to demonstrate the anti-ulcer activity of drugs using pylorus ligation method of rat model. So this was first demonstrated by the scientist Shai in 1945. That's why this procedure is known as the Shai rat model. So ligation of rat pylorus results gastric acid accumulation in the forestomach leads to acute gastric ulcer. This procedure is used to screen the different uh, drugs from the classification of anti-ulcer agent to screening their anti-secretory and anti-ulcer activity. So we'll move towards the experiment of these or the experimental procedures. So before starting to the experiments, there are some instructions that should we have to follow during the experiment. So first, that is the rat should be fasted for 24 hours prior to the pylorus ligation. Then the randomly divided into two groups of 3 animals in each group. The drug should be administered once for 2 days and 30 minutes prior to the ligation. The rats are anesthetized by using some anesthetic agents. So see here we have taken the ether as an example. Pylorus ligation procedure should be done after the anesthetic agent administrations. After that, rats should be placed in a separate cages and allowed to them recover. After 19 hours after the pylorus ligation, the animal should be sacrificed by the decapitation method. Then we have to open up the abdominal part and the stomach should be dissected out. After removing the content from the stomach, all the content of the stomach is collected in one of the centrifuge tube to count the various enzymes or to count the concentration of the stomach content. Then after that, stomach opened along with the greater curvature and the ulcer count is observed under the 10x magnification microscope with the help of the stereo microscope. So here there is a window which is showing that there are the 6 animals. Now we have to place these 6 animals into two groups. The one will be the vehicle treated and second will be the drug treated. Okay, so the vehicle should be or the vehicle will be one of the normal solution, that is nothing but the saline solution, and the second group will be having the treated or the treatment to that animal which is from the category of anti-ulcer agents. So we have to first by following the rules that the drug administration should be done once for 2 days and 30 minutes prior to the ligation procedures. So before to that, we'll understand what is the different parts of your stomach. So here is the diagram for stomach. So after following the esophagus, there is a cardiac sphincter. Then the actual stomach is divided into three parts: the fundus, body and pylorus. And near to the pylorus and before starting to the duodenum, there is a pylorus sphincter, and the upper part there is a cardiac sphincter. Okay, so now we have to ligate this pylorus sphincter with the help of suture. So what we have follow, that we have to first anesthetize the animal. Then we have to give the anesthesia with the help of intraperitoneal route administration. After that, we have to ligate the abdomen and the isolated stomach that we have to observe. Okay. Now we will move towards the actual demonstration. So here, just will increase the speed so we can understand in the particular mode. So after anesthesia 30 minutes after that, we have to ligate the stomach by just giving the section to the abdominal cavity. After that, without disturbing to the blood supply and nerve supply of that animal, we have to ligate the pylorus area of stomach. So here we have given the two knots. After completion of that pylorus ligation, there is need to close the abdominal wall with the help of proper suturing method in very hygienic and by having a good technician or the technical knowledge. So here you can see that the pylorus ligation is now completed. So before starting to the observations, we have to select either the vehicle treated or drug treated. So first of all, we will see the vehicle treated method. So now here the anesthesia is given, ligation is carried out, and after that we have to move towards the sacrification of that animals, and after that we have to observe the ulcer count. For that purpose, after sacrification, the stomach part is isolated from the body of that animal. So here you can observe the greater curvature of the stomach, which is to be dissected, and the gastric content is poured into the one of the test tube for further parameter observations. Now we have to pin out the stomach with the help of pins on the board. Now we have to count the ulcer from the stomach part. So how we can count the ulcer? So here you can see there are the two red patches on the mucosal lining of the stomach. So the first mouse having the 2 ulcer count. Same like this procedure, we have to move towards the second one animal. Again, dissect the abdominal cavity, isolate the stomach, wash it with the vehicle, give cut to the greater curvature part, drain out all the gastric content into the test tube, again wash it, and with the help of pins we have to mount the stomach tissue on the board, and again we have to count the ulcer from the same area. So here we are getting the 3 ulcer count. So 1, 2, 3. Same procedure followed for the animal number 3. So here we are getting the score count for animal number 3. That is 1, 2. 2 ulcers are there. Again, after completion of the vehicle treated observation, we have to shift for drug treated. So here, before ligation, already we have given the drug to the animal. So now we'll see what will happen. So again, we have to sacrifice the animal, isolation of stomach, then the dissection from the greater curvature, again we have to drain all the content from the gastric part, again wash it, again mount the tissue and have a count of score. So Here the observation is 1. So for the animal number 1 of the drug treated group, we get the observation as a ulcer count is 1. Okay, the same procedure should be followed for the next one. So without wasting time, we will directly go and the last that will count the ulcer. So again the score is 1. Same for third one. So here again the count is 1. Okay. Now the experimental procedure is completed. We have to move towards the observation. So here we get the observation for selected group, that is the vehicle treated and the drug treated. So from the vehicle treated, the ulcer count from the mice number 1, 2, 3 are as following: 2, 3 and 2. So average number of score from the vehicle treated is 2.3, and from the second group, that is the omeprazole group, the mouse number 1, 2, 3 are having the observations as 1, 1 and 1. So the average is 1. So we have to download the result and go to the conclusion part. So here we'll get the higher the number of ulcer count in vehicle treated group than the drug treated, and reflects the anti-ulcer activity of the drug that we have taken as an example, that is the omeprazole, is proven. So likewise you will screen all the tremendous classified drug from the anti-ulcer category. Thank you.